Keriise Manchester, Obstetrician and Gynecologist at Manchester Medical. As it is Women's History Month, Keriise is here to discuss a topic that should be a priority for women all around the world, and that is womb wellness. Good morning, Keriise, and welcome.
Thank you so much.
You're welcome. So I'm going to start off right away. So Dr. Manchester, tell us, what exactly encompasses the womb?
So the womb is actually one of the main gynecological organs in a female, and we have a picture right here. So it's a pear-shaped organ in the lower.
This one.
Okay, sorry about that. In the lower pelvis of a female, it's about as big as your fist, and this part right here is what is the womb exactly. So it has different parts. It has the fundus, the body, and the cervix. We tend to talk about the cervix like it's separate from the womb, but it's actually a part of the womb. We talk about it that way because different conditions can affect the cervix separate from the womb, but the body of the womb rather, but it is actually a part of the womb. So that's what the womb is.
All right, so I'm about to get a biology lesson here.
Yes.
Because I do have to ask, obviously, I am, what do I say? My gender doesn't tend to lend itself to an understanding of these things necessarily.
Right.
So womb and uterus, is there any difference between those two terms, or?
A what?
Womb and uterus.
No, same thing. Same thing. Womb and uterus, interchangeable terms.
Check, I got it right.
Yeah.
I didn't know that, and I'm a woman, so I guess I learned that today.
Same thing, same thing.
So can you tell us what are the various parts of the uterus and how do they correlate?
So, as I was saying, you have this top part, which is the fundus, and then you have this middle portion, which is the body. So the fundus is what is above where these fallopian tubes would attach to the womb, and then the body is what's between the attachment of the fallopian tubes here and the cervix. So this is the body, and then you have the bottom part, which is the cervix, which part of it projects into the vagina. Okay. And that's what you can see when you look inside the vagina with a speculum. That's an instrument to allow you to see inside the vagina. So those are the three anatomical separations of the womb, but it also has different layers. So there's an outer layer, which is called a serosa. That's like the covering of the womb, and then you have an inner muscular layer. That's this part here, and then you have the lining of the womb, which is called the endometrium. The muscular part is called the myometrium. The inner part is called the endometrium, and it's the endometrium that's shed every month with a menstrual period.
All right, so let's talk about prioritizing womb wellness. How important is it for women to do that, and how can women do that?
Well, it's very important because the main purpose of, the only real purpose of the womb is to house a pregnancy until it's ready to be delivered. That's the only purpose. However, the womb can be affected by many different conditions, and so you're not having good womb wellness is something that can affect almost every aspect of a woman's life. Even though it really only serves one purpose, because of all the things that can affect it, womb wellness is important for almost every aspect of a woman's life, from birth to end of life. So, as I said, different things affect the womb at different stages throughout life. That's how I like to categorize it. And so, I mean, it's a lot of things. I recently did a talk on this, and it was about 1.5 hours long. So, and that wasn't even scratching the surface, honestly, of all the things that can really happen to the womb. But, you know, some main aspects of womb health are menstrual health, pre-pregnancy health, pregnancy health, menopausal health, and all those things are important. And so along the way, there are different things you can do throughout your life as a woman to make sure that you have good womb wellness. And it really starts even before birth, because there are certain things that, you know, a pregnant woman can do to ensure her female baby's womb health in the future. Yeah, absolutely. So I'll give you an example. When you're pregnant, obviously medication you take, your diet, your lifestyle can affect your unborn child, and there are medications that can actually cause abnormal womb formations for a female fetus. So once ago, there was a medication called diethylstilbestrol, and it was actually given to pregnant women to help them prevent things like miscarriage and early preterm labor and things like that. And it was found that it was causing what's called Müllerian anomalies. A Müllerian abnormality is something that it's a womb abnormality that baby is born with, basically. So it was causing the womb to become T-shaped and other things, and so that obviously that drug is off the market now. But that's just one example of how even before pregnancy you really should make sure that you're going to your doctor, talking to them about medications you're on or things you're doing, smoking, that kind of thing, so that before you even conceive, you can change whatever medication might be harmful to your baby. You can come off it completely. You can be helped to quit smoking, that kind of thing. And that's pre-conception. That's before you even get pregnant. That's the ideal time to do that stuff, so that when you do conceive, because it's that first 4 weeks of after conception when organs form. It's very early, before sometimes women even realize they're pregnant. So, by the time you into your first trimester, everything's pretty much formed. It's just a matter of growing. So,
wow.
Yeah.
So what I'm getting is that us women, when we are pregnant, we are messing with our unborns, let's say daughters, because this is all about the lady's womb.
You can.
So we are messing them up even before they enter the world and think they can be moms eventually.
Yeah. Wow. You can, those abnormalities in general are rare. So most of the times they don't come about, and most of the times most female fetuses will be okay, but you definitely can cause abnormalities for your unborn fetus, for sure.
So Dr. Manchester, during the break, you and myself, we were having a conversation concerning how soon should we check the womb of a child. And you were telling me it is from birth.
Yeah,
because
absolutely.
After I heard of all the defects, it got me concerned. So can you expound on that for us a bit?
Sure. So when any baby, not just baby girls, but baby boys too, when any baby is born, the pediatrician will examine the baby to see if there's any abnormalities head to toe. But with regards to the female genitalia, you can have conditions that are obvious from birth. So you can have what's called ambiguous genitalia, and that's when can't really tell if it's a vagina, can't really tell if it's a penis, it just looks ambiguous. And that could be an indication that there's abnormalities higher up with the womb. And so those things are looked for at birth, because early intervention is what ensures the best outcome in situations like that. And conditions like that would need subspecialist care, so not general gynecologists, reproductive endocrinologists and that kind of thing, which we don't have here. So, that would have to be arranged quite early. So, as I said, those things are looked for at birth, because intervention at the early stages will be key. And just any abnormality, is there any vaginal bleeding? Is there any vaginal discharge with the newborn or the young child? Vaginal bleeding isn't too concerning. There's actually a condition called false menses, which happens with newborn girls because of the, it's normal, the false menses. It's just because of the withdrawal of mommy's hormones. Now that you're out of the womb, can cause a bit of a withdrawal bleeding. It goes away and it's normal. So things like that are looked for at birth. And we're lucky here in St. Kitts where we have very robust well baby clinics, well child clinics in the public system. So, the children go and their growth and everything is monitored from birth to, up to adolescence, really. And, mommies can have the opportunity to air any concerns, which is also important, especially children, adolescents with their womb health. A lot of it is up to the parents, because we're the ones who are aware. The children aren't going to be aware that, hey, this isn't right. And we're the ones bathing the little girls. We're the ones washing their underwear, that kind of thing. So we're going to be the ones to notice when something is right. Does my daughter's do they look right? Does something look abnormal? Is there discharge in her underwear? Is there bleeding in her underwear? That kind of thing. So those things are important for moms and dads to notice and voice when they do see their healthcare provider. That's a very important part of child and adolescent womb health, is parents being present and conscious and willing to vigilantly report things that are abnormal.
What they discover. Wow.
Yes, you can breathe. I know it was a lot, but you can breathe. All right,
I'm just taking it in.
Dr. Manchester, it's Endometriosis Awareness Month. For those of us who are not familiar with what it is, or perhaps just to raise awareness of what it is, can you explain that condition?
Sure. So endometriosis is a chronic condition. If we remember what I talked about in terms of the inner lining of the womb here, that's called the endometrium. It's lined by endometrial tissue, and it's that tissue that we shed every month in your menses, right? And it's what builds up throughout the month of your menstrual cycle. It builds up to receive a pregnancy should you become pregnant. If you don't become pregnant, then it's shed. Regenerates again later in the month. To be ready for another pregnancy. Endometriosis is when that tissue is deposited elsewhere in the pelvis. So it's not only where it's supposed to be, which is inside the womb. It can be deposited on the tubes, on the ovary, on the serosa, or the outside lining of the womb, even on the back of the vagina, on the cervix. It's been found in the lungs even. So those would be very severe cases. And so what happens with endometriosis, because that tissue is other places and it's still under the control of your female hormones, it behaves like it's inside the womb. It behaves like the rest of it would, in terms of growing and shedding and all of those things. So that causes a lot of inflammation and pain throughout the pelvis and stuff where the deposits are. And with that comes a lot of pain. So it's a very chronic, painful condition. And it causes scar formation and adhesions throughout the pelvis, which can distort how the tubes are moving, which is important to get pregnant, that your tubes should be able to move and help the egg and sperm pass through. So that gets affected by the scar tissue formation and the inflammation. So a lot of the symptoms involve pain, chronic pelvic pain, very painful periods, heavier periods, and difficulty conceiving. So those are some of the hallmark features of endometriosis. Yeah. So it can be a difficult condition to treat. It has different stages. It can be very mild, but it can be very severe, where it's found, as I said, in distant organs like the lungs, can cause a lot of cyst formation. As I said, if it's on the ovaries, the ovaries are cystic organ normally has cysts. The problems arise when they get too big or they burst or bleed. And with endometriosis specifically, we get what's called chocolate cysts, because this material, a cyst essentially forms around it. And so you get that material bleeding into the cyst, and that almost looks dark. When blood gets old, it looks dark and it looks like chocolate. So when, they can be very big as well and cause a lot of pain if they burst or bleed into the pelvis, that kind of thing. So, it can be very severe. And some women have it and they don't know because they don't have any symptoms as well. So, yeah.
Us women.
Yeah.
So Dr. Manchester, in closing, is there anything that you would advise women who may be suffering with the condition of endometriosis?
Well, one, very painful periods. I mean, menstrual cramps aren't necessarily abnormal, but very severe painful periods that don't respond to over-the-counter pain medications, etc., are not normal. So if you have menses that are that severe, you definitely need to see your healthcare provider and make sure that you voice your concerns so that you can be adequately investigated for it. Because as I said, there is treatment for it, and early intervention is key. The other thing I also want to point out is that diet and lifestyle and exercise is very important for all conditions that affect the womb, almost all of them. That was a key feature in the talk I gave recently, is that something like obesity can actually worsen endometriosis symptoms, can worsen almost every menstrual abnormality you can have, can affect your ability to conceive by itself, obesity by itself. So, weight loss, healthy eating, diet, exercise is very important as well for womb health.